Welcome back. We've all run into a time where we've needed or our kids have needed a doctor immediately, but we couldn't get an appointment. So one working mom developed a solution. It's called Solv Health. And in addition to being a huge time saver, it's actually had a big impact in the fight against COVID right here in Seattle. I chatted with the CEO and co-founder, Heather Fernandez.
As a parent and a person who also uses medical appointments, I love a shortcut. I love anything that doesn't require me logging into 6 different patient portals to find the thing I need. So I love the idea of Solv Health, but in your own words, tell us what it's all about.
Thank you, Amity. I mean, you are not alone. I'm also a mom. I happen to have 3 kids, and trying to get what I need for myself and my family now when I need it became a priority in the 10 years prior to starting Solv. Once we got to the point where we thought it is our time to start this company, it was pretty obvious, right? And the mission, the point of the company is, how do we reduce the stress of everyday healthcare for every American across the United States? And that basically comes down to 3 questions. Where should I go for the problem I have? Maybe that's on my couch for a telemed appointment. Maybe I'm going down the block. When can I be seen? Don't waste my time. And third, and importantly, how much will it cost me? That's been our mission from the beginning, and we've built this national network across the United States where today 100 million Americans are within 5 miles of a bookable same-day appointment on Solv, and I'm incredibly proud of that fact.
This is kind of incredible to me, because if I were to try to do what your technology can do, I mean, it would take me 5 hours probably to find an appointment I need. So, I mean, I got to imagine during a time like COVID, Solv has been very, very vital.
I think a couple of things to highlight. One is, you can't just create an app on the consumer side and hope that the providers can deliver it on that appointment when it says it's available online. So a big part of our investment over time has been empowering the provider side with software that enables them to deliver that experience to you, the consumer. Everything from making that online availability real-time available, communicating via SMS, digital paperwork for your insurance card so you don't have to fill it out for the 10th time when you go to the physician's office, enabling that in a seamless way. That's a big part of what we do that consumers don't see. And then, to your point, in comes COVID. We'd already built this national network in so many communities across the United States, and really everyday healthcare in 2020 was COVID. What we realized in many ways was that COVID pulled the future forward in American healthcare. The first thing that we did is we were in every community. So we were second only to really CVS in terms of connecting consumers with COVID testing and vaccines in their communities. And that was because the nature of how we thought about our national network. Second is, COVID just changed our mental model, right? Whereas before, if you called the doctor and you got an appointment 3 weeks from now, you would feel so thankful. Thank you for seeing me, doctor. I'm glad that you can squeeze me in. Whereas COVID shifted that to really mean availability now via telemedicine. Those consumer shifts in behavior and consumer shifts in expectations, I think, are going to be what we start seeing playing out over the next many years as healthcare continues to evolve.
How about now with going back to school? What for Solv, what's top of mind with now the variant coming in, the breakthrough infections, possibly backup shots? What's top of mind for Solv right now?
I just dropped my kids off to school yesterday morning. I will tell you, my anxiety was through the roof. My kids were great. Had their masks on, going to see their friends, having the time of their lives. So number one is sharing information with consumers around what is versus this crazy Twitter war that seems to be ensuing on every little step around the pandemic. Second is availability of testing. Just before this conversation, I was talking to a colleague whose kid had a classroom where someone was diagnosed with COVID. She is very stressed. She needs to get her child and her family tested. And so enabling that availability nationwide, building on top of what we did in 2020, is another one of our priorities.
But what about other things? It's sports medicine and like just wellness checks. I don't have a GP. How can Solv help me solve that problem?
With a couple of taps on your phone, you could have that telemedicine visit to have your child's rash checked to figure out if you need to escalate and go to a dermatologist and keep your kid home, or if they're fine, which is typically the case, to get that well check, to get that lab for your A1C tests all of these everyday healthcare needs are what we're building out across the Solv platform so that these millions of people who have come to us, whether it's for an everyday healthcare need or through this really stressful time of COVID, can get more of those everyday healthcare needs for themselves and their families met, answering those 3 questions. Where should I go for the problem I have? When can I be seen? And how much does it cost?
And by the way, Heather told me that 60% of all COVID tests in Seattle were managed through Solv, and that was in partnership with the city and the University of Washington and the Public Health Department. And if you'd like to learn more, visit the website on your screen. You can also find a link on the New Day website. Well, summer is definitely not over, so when we come back, the toy guy and I are going to play with a bunch of toys that help extend summer fun and keep those minds sharp at the same time.
This portion of New Day Northwest is sponsored by Solv Health.